Assalamu alaikum. For today's session, we will just revise the infant CPR. So we said infant, we consider an infant for the first aid with the age of how much? 1 year. So it is from 0 to 1 year according for the first aid services. After 1 year, we will deal with them as a child. And we said that also dealing with CPR, it is depend upon the size of the body rather than the age. So the objective for this session to enumerate and describe the basic steps for CPR for infant and reform the basic steps of basic steps of CPR for infant. Steps in the infant CPR. So in infant CPR, we have to first to do assessment for first the scene. Similar to what we did in an adult. We have first to check the scene for safety of us and the victim. If it is safe, in this case, we have also to introduce ourselves. I have to say that I am a trained first aider. Can I help? You will take the permission from the mother or the one who is available there. Then check the infant response. And we told you how to check the infant response. So we show you that we will tap on the patient foot like this. Oh, are you okay? And he will either, how he will respond? Crying. He might cry or he might open his eyes. It depends upon the level of consciousness of the infant. If no response is there, in this case, if no response, I have to activate the emergency response, asking someone to call the 9999, or I have to call by myself. I have to check the breathing for the infant. Checking the breathing, as we said before, it is also similar to the adult. I have to look for the chest movement. I have to feel the breathing. I have to feel the air which is coming from the mouth or the nose, and I have to hear if there is a breathing sound. If nothing is there, I have to check also the brachial artery. I will not check from the carotid for infant. Only I will check from the brachial artery. No pulse, no breathing. In this case, we have to begin with the CPR if no pulse. Check the pulse. If no pulse, continue with CPR. If the pulse is present, return to recovery position. Recovery position in infant, it is like this position. See, where is my finger? Why I put my finger like this? In order, what's the purpose for that? Yes, in order not to, that head will be down. So, to have a clear airway. So the purpose of that is to have a clear airway, an open airway. And I will put him down like this. The purpose of this also is if he vomit, if something is coming as a vomitus, it will not go back to the respiratory system. So if he vomit, it will not go back to the respiratory system. So So this is how I check. See, he is looking at the chest, feeling his ear is beside the child, the infant mouth, to hear the air which is coming out, and to feel if the air of expiration is coming out. Here, how to locate the brachial artery. The brachial artery, as we said, it's coming from this axillary artery. Then we have the brachial artery is in this side. Then it will be divided to radial and ulnar. So this is the best side that I can just check the pulse for an infant. Also, I have to tilt the head backward, and by that it will open the airway. If any constricted clothes is there also in the neck, I have to open the constricted clothes, similar to an adult. If no pulse, we said that we will start with the CPR for infant. The CPR for infant, I will use only two fingers. So 2 fingers is there. Where I will put them?
The middle of the chest.
At the middle of the chest, over the sternum, between the nipple, so over the sternum, this side. Then I will start the compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 7, 8, 9, 10. Then I have to breathe. 1. In breathing, I have to fill my mouth with air. Then I have to give it, because a very forceful breathe, it will affect the lung. It will lead to emphysema. It will aggravate the condition. So the amount of air, it should be going with the size of the lung. The size of the lung for an infant, it is small. It is not like an adult. So when I blow, I know just the feeling of my mouth. So this is how to open the airway. It is the same. Tilt the head and lift the chin in order to give the breath. Then, as we said, this is the recovery position for a child. This is the recovery position for a child. So this is simply what we are doing with the child, with the infant, in case of cardiovascular problem, in case of cardiac arrest. And we said mostly the cardiac arrest in infant and children, it is due to respiratory problem rather than due to the heart problem, unless if the infant is having congenital abnormalities of the heart. Unless if the infant is having congenital abnormalities of the heart. In congenital abnormality, yes, it might lead to cardiac arrest. Usually in those cases, it will be examined and it will be evaluated from the date of birth to see if there is any problem. So again, if an infant is having cardiac arrest or lose his consciousness, usually, or the mother might shout, anyone is there, can anyone help me? My child is not, I feel that he is not breathing. So you will come, introduce yourself, you say that I am a trained first aider. Can I help? Check the scene also first if for any other cause. See also infant, even infant less than 1 year. Sometime what they are doing, they can pick something, especially after the 7 month or when they are start to go around inside their room. Here they can sometime in the ground, they can pick anything and put it in his mouth. So in order to prevent those things, we have to avoid putting anything around the child that it might lead to suffocation also. It might be a suffocation due to that. It might be due to taking some medicine even. So medicine also should be away from children and infant. So they don't know what is the thing which is there. Usually they cannot open it, but if the medicine is the tablet is in the ground, it might happen. So those are some special things that might happen. So after taking permission, then I will hold the child. I can sit. Yes, because and check the child. Check there is no breathing. I cannot see a movement of the chest. I cannot hear the voice of breathing, or I cannot also feel if there is respiration or if there is air is coming. I check the brachial artery. I call the mother, or if anyone is there to call for emergency, or I have to call by myself after giving 2-minute care. Then I will start with CPR. I open tilt the head backward. I start with the cardiac resuscitation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then to breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah. To breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah. To breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 8, 9, 10. 1, 2, 3, 4, 5, 6, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then now 5 cycle. After the 5 cycle, what I have to do?
Check
Again, check for breathing and check for pulse. If pulse is there, or if before that, if the child starts to cry or to move, in this case, this is a sign of life. So in this case, I have to stop. So when I have to stop, it is similar to an adult. I have to stop when a sign of life is there. Either the child starts to cry or to have a movement. Any movement is there, so it means that he regain his consciousness, or he regain the heartbeat. If another trained health personnel came to take over, I can let him do the rest, and I can take rest. Or if the AED machine is available, so I apply the AED machine, and by that it will give analysis and it will give the props what to do. Or if I feel exhausted, I cannot do anymore. The other thing, in case of the scene is unsafe, as we said, in an infant, when he is between my hand, in this case, I can move with the child. So it is not like an adult. An adult also, if the scene is not safe, if I can move him to a safe place, that's good. Otherwise, I have to escape. So it is a simple procedure that we can do. By that, we can save the life of the infant. What's the rate between compression and breathing? What's the rate between compression and breathing? Compression, heart compression. 30 to 2. So 30 compression and 2 to breathe. For each, now for which one? For the cycle. For each cycle, in each cycle, 30 compression and 2 breathe. After 5 cycles, I have to recheck. So that 5 cycle, it should not take more than 2 minutes. So every 2 minutes, I have to recheck the condition of the infant. The rate that I supposed to give with, in each minute, I have to, the speed, I mean for the compression, it has to be around 100 compression per minute. 100 compression per minute. By that, it will give at least 1/3 of the oxygen need for the body. Okay? Any question?
No.
You can do it by yourself now?
Yes.
So I will give you the doll, and each one of you will start the CPR for the child. Okay, thank you.